Colorectal cancer is a type of cancer that originates in the colon, and by colon I simply refer to the digestive system, specifically the large intestine. Now, this type of cancer is quite common among elderly men, hence a good knowledge of this condition, the symptoms, and the possible treatment is very important to help combat this. Hi beautiful people, welcome back to the channel. If you're stopping for the first time, you're welcome. My name is Shalona and I'm a registered nurse, a registered midwife, as well as a professional makeup artist. And over here we discuss all things pertaining to faith, health, beauty, as well as nursing. So if these are the kind of content you're looking out for, please do not hesitate to like, to share, as well as subscribe to the channel. Colorectal cancer originates from the colon, but in order for us to fully understand this condition, let's look at the anatomy and physiology of the colon and the rectum respectively. Now, the colon and rectum are parts of the digestive system. Now, for the colon, it forms specifically parts of the large intestine of the digestive system. Now, what are the functions of these two parts? After the digestive effect of the small intestine, because you have the small intestine and next to the large intestine, the food matter from the small intestine is being pushed down to the large intestine. Now, in the large intestine, the colon specifically saps out the salty content of the food matter and the water content of it. Now, once this is done, you are left with nothing but fecal matter or waste matter. Now, this waste matter is being pushed down to the rectum, and it is in the rectum it stays until there's need to defecate, and then this is being pushed out of the body through the anus in the form of feces. Having understood that, let's look at the pathway of this condition. Colorectal cancer would normally start off as being growth present in either the rectum or the colon of the body, and this growth is being called polyps. Now, these polyps are usually non-cancerous, meaning they do not spread or do not have the ability of being conveyed from one part of the body initially, but once it stays over time, for a long period of time, it now becomes cancerous, meaning it now has the ability to spread or being conveyed from one part of the body to the other. Now, the factors that could cause these polyps to become cancerous, that is from non-cancerous to becoming cancerous, includes its size. That's the size of the polyps. It includes the number of polyps that you have present there, or the number of growths that you have present there. It includes the appearance or the histology of the polyps, as well as the type of the polyps. Now, whatever factor that may have caused it to turn from being non-cancerous to cancerous, now that it is cancerous, it has the ability of spreading, getting into the bloodstream, and once it gets to the bloodstream, it is ultimately spread around the body and it becomes full-blown cancer. Now, let's talk signs and symptoms. The signs and symptoms of this condition includes abdominal pain. There could be rectal bleeding, usually bright red in color. There is usually intestinal obstruction. There could also be weight loss, as well as change in bowel movement. Now, what are those factors that predisposes you to coming down with this condition? I said earlier that this condition is common among elderly men. So therefore, if you are a man, you are at risk. If you are elderly, that is from 50 years and above, you are at risk. If you've had personal previous history of this condition or family history of this condition, you are at risk. If also you've had personal history of inflammatory bowel disease, you're also at risk. Being black puts you at risk, as well as having poor dietary choice. This condition can be diagnosed through colonoscopy, biopsy, imaging test, as well as blood test. Now, let's talk treatment mechanism. Now, since this is a cancer, the treatment mechanism is always going to be centered around surgical intervention, immunotherapy, chemotherapy, as well as radiation therapy. But whatever type of treatment is being carried out, it depends on the stage of the cancer. Okay, now for the radiation therapy, you're making use of radiation to shrink the cancer before intervention is being carried out in the form of chemotherapy or immunotherapy, which involves the use of drugs to help kill off the cancerous cell. Now, surgical intervention is usually carried out when the cancer is of a larger size or the polyps is of a larger size. Now, let's look at prevention. I am team prevention is better than cure, but you cannot categorically prevent yourself from coming down with this condition. But there are certain factors or certain things that you can do to help reduce the risk of your coming down with this condition. You have to carry out lifestyle modifications. So if you're that kind of person that eats a lot of processed food, especially processed meat, please, you have to stop that. Also, you have to stay active. Physical exercise is very, very good. One thing I would say is individuals who smoke, who are obese, are usually at risk of coming down with most conditions. Most of the conditions you have there. So you want to ensure that you are at a very healthy weight. Okay, that being said, I've come to the end of this video. I hope I've been able to convey to you the message as regards colorectal cancer. I mean, this is colorectal cancer month, so please ensure you take good care of yourself. If you have any questions, please let me know in the comment section below, or recommendations. And until I see you next time, bye, love, peace, and God bless.